holding a stethoscope only around his neck. This clarification is necessary for GTech's sake. PhD programs in the Department of Clinical Microbiology at KNUST were started under his headship, and he has up to date mentored and supervised about 40 PhD students in clinical microbiology, infectious diseases, reproductive health, among others. Some of his students include the current Vice Dean of the School of Medical Sciences, Professor Stephen Safo, Professor Feglo, Department of Clinical Microbiology, Professor Mrs. Obri Yeboah, UCC, Dr. Ejaku Poku, Sontreso Government Hospital, and other international students then from the London School of Hygiene and Tropical Medicine include Professor Wilm Quentin, who is one of the speakers for today from the Technical University of Munich, Germany. Our chair today was the Dean of the School of Medical Sciences from 2012 to 2017, and then became the Provost of the College of Health Sciences 2018 to 2021. After he finished as Provost, he was asked by the current Provost of the college, Professor Christian Ejare, to chair the planning committee for the 9th and 10th College of Health Sciences Scientific Conference in 2021 and 2023. The college has also been grateful to him for his continuous service anytime he is called upon. He continues to mentor graduate students and currently works with 5 PhD and 7 MPhil students, even in retirement. With lifetime publications of over 200, 2 patents, a research interest score of 4,650, and an H-index of 49, he is currently the editor-in-chief of the Journal of Science and Technology, which is the official academic journal of the university, this university. And the journal, called JUST, publishes articles in humanities, biomedical sciences, engineering, built environment, and agriculture, as well as natural resources. Distinguished invited guests, ladies and gentlemen, join me in welcoming Professor Yao Edu Sarkodie as our chairman for this year's conference.
Thank you very much, Professor Dankwa, for this introduction, and good morning. Yeah. I wish to stand on the protocols established by the planning committee of the conference and read out to us by Professor Dankwa. Thank you. We are told yesterday the scientific conference of the College of Health Sciences under the theme, Bridging the Gap, Multidisciplinary Approaches to Strengthening Ghana's Health System began. A series of skills-building pre-workshops sessions took place across the college in the various schools and faculties. Started in 2008, this is the 11th of such biennial conferences of the college. I wish to acknowledge the vision of Professor Peter Donko, the then Provost of the college, in starting this excellent scholarly activity. Professor Chiri Agbanyega and I, who followed Professor Donko as Provost, continued with us, importantly looking for sustainable funding for the conference. And thank you, Professor Jare, for continuing with this tradition. For a college that is responsible for about 1/3 of publications churned out by this university, it is important we showcase that we do not only produce quality and well-educated health professionals, but also work within impactful research to inform our teaching and national and global policy. To address aspects of the conference theme this year, the planning committee has assembled great and seasoned academics, people in the policy space, and researchers, and also health leaders. They will speak to us on important health challenges, hopefully with solutions to address these. Buzzwords like strengthening, innovations, pragmatic solutions are attached to some of the topics to be addressed. It is hoped that this will not be more of the same as has been heard and done in the past, but will bring fresh insights into the issues to be addressed. The Planning Committee has done a great job putting this conference together. As Professor Nkrumah said in the introduction, I have traveled this path before, and I know how challenging this planning can be. Thank you, Professor Nkrumah, and your Planning Committee for putting this together. On this note, I accept the chairmanship for this session and look forward to the conference. Thank you.
Thank you very much, Professor Edusah-Cordier. It's an honor to have you as our chair. Now, the conference brochure has been disseminated on the platforms of all the schools. But just in case you don't have the brochure, on your tag, there's a code you can scan, the tag that you have around your neck. When you scan it, you can download the brochure. Also, we have an app that you can download onto your phone so that you can follow the events of the next 2 days as we go through our program outline. So next, we'd like to welcome the chairperson of the 11th Biennial Scientific Planning Committee. He also happens to be the Dean of the School of Medical Sciences, KNUST. Ladies and gentlemen, please put your hands together as we welcome Professor Nkrumah to give us the welcome address.
Thank you very much, Amma. Good morning. Guten Tag. Herzlich willkommen. I'm trying to remember my German. Professor Cynthia Amenindankwa, thank you very much for establishing a solid protocol that I think we can all stand on. I have a simple assignment this morning, and that is to welcome you all to our 11th Biennial Scientific Conference. On behalf of the Provost of the College of Health Sciences and the Conference Planning Committee, I warmly welcome you to the Kwame Nkrumah University of Science and Technology. This 11th Biennial Scientific Conference provides a platform to dialogue and collaborate on innovative healthcare delivery approaches that can transform systems and improve lives. This year's theme, as already has been mentioned, Bridging the Gap, multidisciplinary approaches to strengthening Ghana's health systems. This reflects our commitment to fostering collaboration among diverse health professionals, policymakers, researchers, and educators. The conference will focus on addressing systemic gaps in access to care, enhancing interprofessional collaboration, advancing health technologies, and strengthening policies that support equitable, efficient, and sustainable healthcare delivery. As a college, we hold firmly to the belief that health is indeed wealth, and that the well-being of our nation must remain central to all our endeavors. This commitment is evident in the quality of education and training that we provide to our students, who we prepare to be leaders in the healthcare industry. Professor Chairman, distinguished ladies and gentlemen, we are privileged to host experts from Ghana and beyond who will share their knowledge, experiences, and practical insights. We trust that participants will leave not only enriched with new perspectives, but also inspired to renew their dedication to universal health coverage and stronger health systems. On behalf of the Planning Committee, I wish to express our sincere gratitude to the Provost for entrusting us with the responsibility of organizing this important event and also providing the needed financial support. We acknowledge the general support of our sponsors, without whom this conference would not have been possible. Finally, we wish all participants a fruitful and engaging conference and hope that the learning and experiences shared here will remain impactful long after the sessions have ended. Welcome once again, and thank you for joining us. Thank you.
A round of applause again for the chairperson of the Conference Planning Committee, Professor Nkwikusi. Yes, throughout planning, throughout all the stages of this conference has been a very formidable team who have been at the back. And as mentioned earlier, this 11th Biennial Scientific Conference is being organized in partnership with the German West Africa Center for Global Health and Pandemic Prevention, GWAC. And even to know much about what is going on in this conference, go to Play Store and download CHS events. You would see all that is going on, and it would give you feedback, it would give you notifications, and that is the way you can also engage with us. Ladies and gentlemen, to give us an opening remark is the Director of the German West Africa Center for Global Health and Pandemic Prevention, Dr. John Humphrey Amwesi. Please, a round of applause.
Thank you very much, Princess, for that. I stand on the existing protocols that have been established, and I wish on behalf of GWAC to welcome you all to this conference, the 11th Biennial Scientific Conference of the College of Health Sciences. We're very pleased as GWAC to be partnering the college for this conference, and we're very grateful to the Provost and the leadership of the college for this opportunity. This particular edition of the conference is very special to us in two ways, because our selected theme is Bridging the Gap, Multidisciplinary Approaches to Strengthening Ghana's Health System. And this takes a position that multidisciplinary and multi-sectoral approaches to research and practice have an important role to play in addressing the various health issues that we face, including health security needs. It also provides an opportunity for impactful reciprocal science, policy, practice, knowledge, and transfer. As a graduate training center of excellence in global health, GWAC is very pleased to share insights of our research findings and to listen to our experts addressing the existential threat that we face in the world today, brought about by pandemics and other concerns. In fact, these pandemics do affect the health and welfare of people, not only in Ghana, but across the West African sub-region and across Africa and the world. And we believe that through a trans and interdisciplinary research that we conduct, targeting the drivers of pandemics, we should be able to come up with new knowledge and information which would lead us to find solutions to address these issues of extensive agriculture. We need to eat, but how can we produce our food in a more responsible way? And issues of spillovers of pathogens from animals to humans, and vice versa, I must say. These are all important to developing a resilient health system. There are issues of governance, sustainable financing, and appropriate human resource capacity building. All these are issues which GWAC seeks to address through inter and trans and multidisciplinary research, mainly using a One Health approach. In addition, GWAC serves as a networking platform for stakeholders from health, sciences, policy, and practice with interest in West Africa primarily, but also other parts of the continent. Therefore, through your active participation in the conference, we hope to have a wonderful exchange with you all and to keep connected and to discuss emerging trends and transformations of the health system in Ghana and those elsewhere. Once again, I would like to take the opportunity to welcome you all to the 11th Biennial Scientific Conference of the College. Your numerous contributions, be they by way of questions, by way of talks and posters, and sharing of your experiences, I believe will be very important for fruitful discussions and for shaping the conference to a successful end. You have a great time here in Kumasi, to those of you who are not local, and we wish you the very best. Thank you.
Another round of applause for Dr. John Amuisi. So on behalf of the media team, they would like to honorably ask those who are at the back to move forward, to fill in the seats so they can capture the events beautifully. So if you're at the back, we kindly ask that you move forward. We'll be very grateful if you do that. So we are bridging the gap. And to bridge the gap, we know that we need to collaborate with other organizations. So we have sister organizations here, and we would like to welcome them to give their goodwill messages. So first, we'd like to welcome the head of missions, German Embassy, Accra, Ghana, Miss Jensen Sivin, to give us her goodwill message. Please put your hands together for her.
Thank you. Good morning, everybody. I'm Johanna Klotz. I'm welcoming you here in the name of my colleague who couldn't be here. I'm the head of development cooperation from the German Embassy. And thank you also for establishing the protocol that we just heard. On behalf of the German Embassy in Ghana, it's an honor for me to join you here today at the 11th Biennial Scientific Conference of the College of Health Science here at KNUST, in partnership with the German West African Center for Global Health and Pandemic Prevention. Germany is proud for the close partnership with Ghana in health cooperation and research. And I learned that it dates back many decades and is connecting not only several institutions from Germany and Ghana, but also individuals from the scientific community in both countries. Here at GWAC, we work side by side to build capacity, advance research, and translate knowledge into practice with support from the German Academic Exchange Service, the Federal Foreign Office, and prominent German research institutions like the Technical University and the Charité in Berlin and the University of Bonn. This collaboration uses an interdisciplinary approach for pandemic prevention and resilient healthcare system, as the challenges we face cannot be met with only one discipline. And I think the theme of this conference here today and tomorrow could thus not be more timely. But it's not only scientists from different fields that need to be working together, and it's not only me speaking as a policy officer. This conference is more than just an academic gathering. You're convening researchers, policymakers, and practitioners to work together so that evidence can inform us to create better service and better outcomes. The conference is a signal of our shared commitment to preparedness, equity, and quality. Germany remains very committed to this partnership with Ghana, here with KNUST and with GWAC. Together, we will turn research into resilience for Ghana and the wider region. My warm congratulations to the organizers of this conference, to all the speakers and all participants. May your discussions spark new ideas, strong collaborations, and practical solutions that will last well beyond these days. I wish you all a successful conference. Thank you.
Thank you so much. So next, we'll call the program manager, German Academic Exchange Service, or the DAAD, Miss Hannah Cornelius. Ladies and gentlemen, please put your hands together for her as she approaches the stage.
Many thanks. Ladies and gentlemen, dear chairman, distinguished guests, all protocols observed. On behalf of the head office of the German Academic Exchange Service, DAAD, I'm honored to bring you warm greetings and a message of solidarity here at the 11th Biennial Conference of the College of Health Sciences at KNUST, held in partnership with the German West African Center for Global Health and Pandemic Prevention, GWAC. DAAD is proud to support GWAC as an initiative of our Global Centers for Climate and Health, a program we implement since 2001 with funds provided by the German Federal Foreign Office. These global centers, including GWAC here in Ghana, but with other centers spread all over Africa, Asia, and Latin America, were established to foster international, interdisciplinary collaboration in response to some of the most pressing global challenges of our time, climate change and pandemic preparedness. GWAC stands as a model of what meaningful partnership can look like. It's a collaboration between institutions, we already heard the names of them, in Germany and Ghana, grounded in scientific excellence of all partners included, based on capacity building and a shared commitment to health equity across West Africa and beyond. It's through such partnerships, long-term, co-created, and locally anchored, that we believe lasting impact is possible. We heard from Prof. John on the topics and results of GWAC, and are happy to have financed this project since nearly 5 years now. We at DAAD remain committed to supporting this work and to empower local talent and leadership, and are happy to announce that we will finance a second funding phase for another 5 years. The contract is not yet signed, but this is only a question of weeks, as the review of the proposal was already successful, and I'm really looking forward to seeing GWAC 2 implemented. With this positive news, I wish you a productive and inspiring conference, and I look forward to seeing how the ideas shared here will contribute to a stronger, more resilient health system in Ghana and across the region. Many thanks.
Thank you, Ms. Colenius, for that wonderful message. When you have many brothers and sisters, the party just gets merrier. So we have one more sister organization we would like to invite. We would like to invite the West Africa Regional Director, DAAD Regional Office, Accra, Ghana, Miss Lena Lumer. Please put your hands together for her.
Good morning. Everyone is awake, that's great. So, dear Chair, distinguished guests and colleagues from Ghana, Germany, and all over Africa, all protocol observed. It's a great honor to join the biannual scientific conference here at KNUST today. I remember the beginning of GWAC. I remember it because in 2020 I received from my colleague in Germany the application documents asking me for a statement for an appraisal of the application, and obviously it was very positive. I really wanted this project to go forward, especially because looking at the cooperations that were already in place between KNUST and different German higher education institutions, I knew that the project would be standing on very solid feet. The fact that the next round of funding has just been approved is just another proof of that. Generally, I think, from my experience, when corporations grow organically and you have the right partners on both sides, that is when the corporations always grow stronger and continue. And then finding the money is just a side issue. You always find money for good corporations. I've been in Ghana since 2017. You might hear from my English. So we have seen a lot of growth overall in the academic exchange with Germany. Not only in health sciences, although that obviously is a very strong field, but all over. And we have really witnessed it in the office. We have delegations coming from the German side all the time. A lot of the corporations also growing organically, growing, for example, out of scholarships. We have a single PhD scholarship holder who goes to do research in Germany. From there, you have more PhD scholarships. Then maybe we have a professor coming here for a research stay. And from there, we go on to the bigger corporations. And I still think that's a very good way to grow cooperation. We also see growth in student numbers from Ghana, and then in the scholarships. In 2024, DAAD awarded 1,500 scholarships to Ghanaians for different types of funding, making it the #1 in sub-Saharan Africa when it comes to scholarships. Yes. And now the DAAD and also the German Ministry of Foreign Affairs are honoring this role of Ghana as a hub of cooperation in West Africa by making the country office, the sort of well-known information center in Accra, a regional office. Yes. So the regional office in Accra has now, for now, assumed responsibility of Cameroon, Nigeria, and Ghana, actually taking the top 3 countries of origin of students in Germany and sub-Saharan Africa as well. We have it in this order. Nigeria, Cameroon, and Ghana are the top 3, really large number of students who want to study in Germany, which also again shows that the linkages are very strong. The office in Accra, that's just a quick reminder to everyone, we offer advisory services for researchers, for students, not only on scholarships, but also for self-funded stays in Germany. And then also we are a contact point for the higher education institutions in Ghana, Nigeria, Cameroon, and also in Germany. So please, if anyone has a question, always reach out, go to our website and find out more. We welcome everyone to our office. Everything is free of charge. That's just a quick public service announcement. To conclude, Ghana is full of exciting opportunities for cooperation. KNUST and the DAAD regional office are testimonies to that. So without further ado, I have one last thing to say to all of us for this conference. Ayeko.
Yeah. And hold on, Ms. Lumiere. Hello. What is your Ghanaian name? Because you really sound Ghanaian.
It's Ajwa.
Ajwa, wow.
And my husband is Kojo. And my son is also Kojo.
Wow. Ajwa and Kojo, they begot Kojo. Wow. Thank you so much. All right. So we'll be moving on and we'll be hearing from the host of this program, which happens to be a provost. But before we do that, we know Kumasi is known for its rich culture. Rich Ghanaian culture is exhibited here in Kumasi. The best culture you can find in the whole Ghana is here because we have the King of Ghana, Asantehene, ruling from Ghana here. So we want you to relax. You can also stretch as we take a musical interlude and a cultural performance from the KNUST SHS Cultural Group. Ladies and gentlemen, put your hands together for our young ones as they come up.
Thank you very much. Very energetic dance here. We believe that at the end of the day, you would pick one or two. Thank you very much, KNUST Senior High School. We are very grateful. We have a tall list of guests we would acknowledge as time goes on, but we would like to acknowledge a few before we listen to the host. This morning, we would like to acknowledge the presence of the Pro-Vice Chancellor of KNUST, Professor David Asamoah. Please, a round of applause. Thank you very much, sir. We have the Chief Director, Ministry of Health, who is representing the Minister of Health, Honorable Minta Akando, Mr. Desmond Boateng. Please, shall we acknowledge him? Thank you very much. We would also like to acknowledge the Deputy Director of Christian Health Association of Ghana, Dr. James Gia. Please, let's acknowledge him. We would like to acknowledge Prof. Quentin, who is the project leader, German West African Center for Global Health and Pandemic Prevention. Please, let's acknowledge him. We would also like to acknowledge the CEO of National Vaccine Institute, Dr. Soji Tete. Please, a round of applause for him. We will continue to acknowledge our guests. It's a tall list. We will continue to acknowledge as time goes on. We would like to welcome the Provost of the College of Health Sciences. He is hosting this scientific conference, and therefore he deserves a very thunderous round of applause. Shall we welcome Professor Christian Ajari? Please, a round of applause.
Thank you very much, Dr. Princess Champon. I think what the KNUST cultural troupe performed really confirmed what Dr. Amamwesi said. The region is a center of culture, and we are grateful for the display. Professor Chair, with your permission, since I have some few bosses, I will acknowledge them. The Vice Chancellor, Professor Rita Kusia Dixon, who is ably represented by the Pro-Vice Chancellor, Professor David Asamoah, and then the Honorable Minister for Health, Honorable Kwame Akando, who is ably represented by the Chief Director, that is the Chief Technocrat in the ministry. And if you have the Chief Director here, we've had some conversations. You are more closer than anybody to the minister. We are grateful for your presence. And now, Professor Chair, with your permission, I want to go by the established protocol. Good morning to you all, and to our German partners. Guten Morgen. If I have not greeted you in German, it means that the 4 years that I spent in Germany for my doctoral training will not be acknowledged. It is with deep honor and a great pleasure that I welcome you to the College of Health Sciences of the Kwame Nkrumah University of Science and Technology, Kumasi. To our foreign partners and international participants, I hope your stay on KNUST campus will be a pleasant and memorable one. Professor Chairman, the Biennial Scientific Conference of the College of Health Sciences, established in July 2008, has been a beacon of academic and research excellence. It has created a platform where ideas are tested, partnerships are forged, and solutions are designed to address health challenges of our time. The 11th Biennial Scientific Conference stands out from previous ones. This is the first time we have organized a pre-conference workshop accredited with the continuing professional development points by the various professional bodies across the country. It is also the first time we have partnered with German West African Center for Global Health and Pandemic Prevention, GWAC, and a collaboration between Technical University Berlin, Charité University of Medicine, Berlin, and then the University of Bonn, all in Germany, with funding from the German Federal Foreign Office through the German Academic Exchange Service, DAAD, Global Women's and Children's Wellness Alliance, to host this event. In line with the Sustainable Development Goal 17, which is Partnership for Goals. Again, as part of our capacity building initiatives, postgraduate students have been offered the opportunity to present their research findings, and they are kindly encouraged to engage actively, foster new partnerships, collaborations, and networks, all aimed at further strengthening and enhancing our collective output as a unified team. Professor Chairman, the theme for this year's conference, Bridging the Gap, Multidisciplinary Approaches to Strengthening Ghana's Health System, is not only aspirational, but also aligns with Ghana's health policy priorities as outlined in the Health Sector Medium-Term Development Plan 2022 to 2025, and then the Universal Health Coverage Roadmap 2020 to 2030. Both frameworks stress the urgent need, 1, to strengthen health governance and leadership, 2, improve health financing for equity and sustainability, 3, expand and retain a skilled health workforce, 4, enhance health information system for evidence-based decision-making, 5, ensure access to safe, effective, and quality medical products and technologies, and last but not the least, deliver integrated, people-centered health services. While these policy frameworks are strong, policy documents alone cannot save lives. What bridges the gap between policy and impact is action. That is multidisciplinary, evidence-based, and culturally sensitive. It is on this premise that the parallel sessions for the conference have been designed to address real-world issues. 1, tackling brain drain with pragmatic retention strategies. 2, designing innovative financing models to make healthcare accessible and sustainable. 3, leveraging digital health platforms like Lightwave Health Information System Management, LIMS, and e-pharmacy services. 4th is enhancing quality assurance systems to meet international standards. The 5th is integrating modern and traditional medicine in a way that is safe, respectful, and active. The last but not the least, applying One Health approach to manage zoonotic diseases, prevent and manage future pandemics. The pre-conference workshops are accredited by the Medical and Dental Council, Nursing and Midwifery Council, Veterinary Council, Allied Health Professions Council, Pharmacy Council, and the Ghana Psychology Council. And CPD points will be awarded to participants. The pre-conference workshop is a model of multidisciplinary collaboration reflecting the Universal Health Coverage Roadmap's call for continuous professional education so that every health worker is equipped to meet evolving healthcare needs. Presentations at this conference will eminently demonstrate what we as health care professionals and scientists bring to the core to complement the work of the health services in addressing the daunting battle of mankind against human diseases and promoting healthy lifestyles as required by the Sustainable Development Goal 3. Professor Chairman, the COVID-19 pandemic taught us that no single profession can address the most complex health crisis. Ghana's vaccination drive, for example, succeeded because public health experts, logisticians, data managers, clinicians, public health nurses, pharmacists, and local leaders work together. We must apply the same spirit of collaboration and teamwork, not only in times of emergency, but also in our day-to-day healthcare delivery. Ladies and gentlemen, the success of this conference will not be measured by the quality of our presentations, but also by the impact of our collective recommendations and actions. When we gather again in the next 2 years, may we be able to point to changes in policy, improvement in practice, and measurable gains in healthcare delivery that can be traced back to the ideas and partnership formed here. Professor Chair, allow me to borrow a phrase long circulated in global health circles, and I quote, "The health of a nation is the wealth of that nation," end of quote. On this note, I called on all of us to bridge the gaps between disciplines, between research and policy, between innovation and implementation, between health systems and communities that we serve. On behalf of the College of Health Sciences, I extend my gratitude to our organizing committee, ably chaired by Professor Akwesi Ekusi, our regulatory bodies, our resource persons, partners, especially GWAC, and every participant who has traveled from near and far to join us. May our discussions be bold, our collaborations enduring, our impact be transformative and innovative in our workplaces and facilities. I wish all of us a rewarding and inspiring learning experience. Thank you very much.
A round of applause to the Provost of the best college in KNUST. I say it again, to the best college in KNUST. And we would like to acknowledge the Provost of the College of Engineering, Professor Brichum. Please, a round of applause. Ladies and gentlemen, in our midst, we have other guests we would like to acknowledge. We have the Director of Office of Grants and Research, Professor Philip Enchi Ejay. Please, a round of applause for him. We have the Director of University Health Services, Dr. Kwame Eyisi-Boateng. Please, a round of applause. Thank you. We have the Director of KCCR, Professor Richard Phillips. Please, let's acknowledge him. We have a representative of the Vice Chancellor of Kumasi Technical University, KSTU, Dr. Ejabeng. Please, shall we acknowledge you? Thank you very much. We have the Medical Director of Komfo-Anokye Teaching Hospital, Dr. Kwejo Sabing. Please, thank you very much. Please, let's acknowledge him. And now, representing the Minister of Health, in delivering the keynote address this morning on the theme, Bridging the Gaps, Multidisciplinary Approaches to Strengthening Ghana's Health System, we have the Chief Director, Ministry of Health, Mr. Desmond Boateng. Please, let's welcome him with a round of applause. Please applaud till he's here. He's our keynote, and we appreciate him so much. Thank you very much.
Thank you very much, MC. Good morning, ladies and gentlemen. So hope everybody is fine. Okay. This morning I'm here to represent the Minister for Health, in the person of Honorable Kwame Minta Akando. He's requested that I extend his apologies to all of us. He would have wished to be here, but as a politician, you can even be sleeping and meet in the night. You get a call, and before you realize, assemble you to a meeting, that sort of thing. So he's asked me to extend his apologies to all of us. And that notwithstanding, I will proceed to read the speech on his behalf. And since the protocols have already been established, I think I'll also stand on that and read the speech. It is both an honor and a privilege to join you at this important gathering of some of Ghana's finest minds in health education, research, and service. I bring you warm greetings from His Excellency John Dramani Mahama, the President of the Republic of Ghana, and also from the Ministry of Health. We are often reminded that health is the greatest wealth. And today, in this hall, we are gathered as guardians of that wealth. Researchers, clinicians, policymakers, and students. Each of us holding a piece of the solution. What gives me hope is that here, those pieces come together. I stand before you not only as a Minister for Health, but as a partner in a shared mission to build a health system that leaves no Ghanaian behind. We live in a time when diseases spread quickly. Technology evolves even faster, and our communities rightly demand more from their health systems. No single profession, ministry, or sector can carry this burden alone. That is why your presence here matters. That is why this conference matters. Distinguished guests, the team before us, bridging the gaps, multidisciplinary approaches to strengthen Ghana's health system, goes to the heart of this government's vision for health care. Under President Mahama, we have set out our sights firmly on achieving universal health coverage. But not as an abstract ideal, rather as a lived reality made possible through the promise of free primary health care. We want every Ghanaian, no matter where they live or how much they earn, to walk into a facility and access essential care without fear of cost. That is what bridging the gap means in practical terms. Removing the financial and geographical barriers that too often separate people from care. At the same time, we must look beyond prevention and primary care. More and more of our citizens are living with non-communicable diseases, hypertension, diabetes, cancers that require long-term management. To respond, the Ghana Medical Trust Fund has been established, a bold step to ensure that the treatment of chronic conditions does not impoverish families. This is about compassion in financing, compassion in fairness in access, and dignity in care. Yet, ladies and gentlemen, facilities and financing alone cannot transform health outcomes. People do. That is why we are scaling up the training of specialists and equipping health workers and the skills they need, so that whether in Accra or Bungugru, Ghanaians can count on competent, dedicated professionals. But even the best trained doctor cannot succeed in isolation. The truth is that health is never the work of one discipline. It is the outcome of collaboration between the clinician and the laboratory scientist, the public health nurse and the community leader, the pharmacist and the supply chain expert, the engineer who designs the equipment, the IT specialist who builds digital systems, the economist who models financing, and the social scientist who helps us understand behavior. When we speak of bridging the gaps, we are not only talking about infrastructure and access. We are talking about bridging disciplines so that knowledge converges into solutions that are smarter, faster, and fairer. That is why the Mahama administration is deliberately fostering partnerships that cut across traditional silos. When free medical health care is delivered in a rural clinic, it is medicine, logistics, technology, and local governance working together. When the Ghana Medical Trust Fund supports treatment for an NCD patient, it is policy, finance, pharmacy, and social protection working in concert. That is what interdisciplinary practice looks like in real life. Integrated solutions that meet the whole person, not just the disease. Ladies and gentlemen, every gap in our system has a human face. A mother who works for hours to reach antenatal care. A child lost to a preventable disease. A nurse working in a clinic without electricity. A young doctor overwhelmed by lack of tools. A community unheard because the system did not listen. These are not statistics, they are lives. And every gap unaddressed is a missed opportunity to protect life, restore dignity, and advance equity. This is why bridging the gaps requires more than constructing facilities or buying equipment. It requires connecting research with policy, cities with villages, and people with care. It requires drawing strength from multiple disciplines, not in competition, but in collaboration. That is the spirit of this conference, to spark not just discussion, but just solutions. Not just research, but reform. If Ghana is to build a resilient, inclusive, and responsive health system, bridging the gaps must be a shared duty across ministries, across sectors, across generations. This is not only the work of the health sector, it is nation building. As I conclude, allow me to share two reminders. The first is an African proverb, and I quote, "If you want to go fast, go alone. If you want to go far, go together." Strengthening Ghana's health system is not a sprint. It is a long and urgent journey, one we must take together. The second comes from the late Kofi Annan, and I quote, "Knowledge is power. Information is liberating. Education is the premise of progress. But progress only comes when knowledge is shared across disciplines, across borders, and across barriers. Let us therefore move forward with renewed purpose. Let this conference ignite ideas, inspire action, and strengthen partnerships. Together, we can bridge the gaps. Together, we can build a healthier Ghana. God bless our homeland, Ghana, and make our health sector great and strong. Thank you for your kind attention.
Thank you very much. Please, Mr. Boateng, we would humbly ask you to stay on the stage. Mr. Boateng, please, we humbly ask you to stay on the stage as we call on the Provost, Professor Christian Ajari, to join you on stage and to present something to the Minister of Health for the role he's played in this conference on behalf of the Scientific Committee. Thank you very much, Provost. And thank you. And now we would like to hear the address of the Vice Chancellor. Representing her is the Pro VC, Professor David Asamoah. Please shall we welcome him.
Thank you, Princess. Professor Chair, with your kind permission, I would like to stand on the existing protocol. Good morning to you all. I bring you warm regards from the Vice Chancellor, Professor Mrs. Rita Akosua-Dixon, who, though unavoidably absent, has asked me to represent her and deliver this message on her behalf. It is a joy to welcome you all to KNUST and to this important gathering of the 11th Biennial Scientific Conference of the College of Health Sciences. At KNUST, we believe that knowledge must always meet action. This conference gives us the opportunity to reflect on that truth as we explore this year's theme, Bridging the Gap, Multidisciplinary Approaches to Strengthening Ghana's Health Systems. The challenges of health and well-being are too complex for any single discipline or profession to solve. It takes collaboration, openness, and shared purpose. I am particularly pleased to see the strong partnerships represented here through our colleagues from Ghana, our international partners, our students, and our practitioners. Your presence is a reminder that progress in healthcare is truly a collective endeavor. As a university, we are proud to provide a platform where ideas can be tested, solutions proposed, and partnerships deepened. My hope is that the discourse that begins here will ripple far beyond these walls, in shaping policy, improving practice, and touching lives across Ghana and beyond. On behalf of the university, I thank the College of Health Sciences, our partners, and all who have worked tirelessly to make this conference possible. May our time here together be fruitful, inspiring, and impactful. Thank you.
Thank you very much, Pro VC. We shall now move on to our plenary scientific session, and we'll be looking at sub-theme 1, which talks about the health workforce. We want to understand how brain drain is affecting our health workforce and how we can solve this problem. To do us the honors, I have Dr. Kwesi Asabre. Dr. Kwesi Asabre is the former director of the Human Resource for Health Directorate at the Ministry of Health, Ghana. He is a seasoned human resource practitioner with over 22 years of experience at the senior management level of the Ghana health sector. Dr. Asabre holds a BSc in Health Sciences Education completed in 2004 from the University of Cape Coast, Ghana, and an MSc in Human Resource Development, also completed from the University of Manchester, UK, and a PhD in Development Policy and Management in 2009. He is passionate about investing in people, and this has motivated him to establish the Asabre Foundation, which aims to share love and change lives. He is also an author and has authored the book entitled Mighty Power for Transformation. Ladies and gentlemen, please give a round of applause to Dr. Kwesi Asabre.
Thank you very much. Good morning to everyone. Professor Chairman, I also stand on the existing protocols. I thank the organizers for inviting me to be one of the speakers at this 11th Biennial Scientific Conference. I am humbled. I have a presentation to make, and I believe the IT is putting it up. If they are not ready, I already have my hard copy with me. And since I cannot wait for them, I'm supposed to deliver within 20 minutes, I'll go ahead. I'm speaking on pragmatic solutions to brain drain and its impact on service delivery. I have come out with 5 items to guide my presentation. Background: why is brain drain a global concern in relation to the health sector? How does it impact on Ghana's healthcare delivery system? What pragmatic solutions needed to mitigate brain drain in Ghana? Conclusions and call to action. The vision of the Ministry of Health is to have a healthy population for national development. This is in line with Agenda 2030, where global policy direction is recommended for UN member states, where we talk about SDG 3, which focuses on universal health coverage. The Ministry of Health, Human Resource, in 2020, led the formulation of a policy, that's National Human Resource Policy, that indicated how human resource will contribute towards achieving the universal health coverage and also ensuring that Ghana has a healthy population for national development. This policy has 6 thematic areas, and the thematic areas work together to ensure that human resource impact access to quality healthcare in Ghana. The first thematic area is to look at availability of appropriate skill mix through training and education. If you have the numbers in the sector, that doesn't mean we can ensure healthy population for national development. Neither can we achieve universal health coverage. These numbers will have to be distributed equitably to all the 16 regions in Ghana after these skills have been recruited. There are certain locations that health workers will not accept postings to. So the policy recommends that mechanisms are established to attract and retain this critical staff in deprived areas. When they get there, the working environment is critical. The working environment should be very conducive to enhance productivity. The working environment can be provision of basic tools and equipment. And there is the need to provide good leadership and governance. Health workers, by the grace of God, have the skill to address disease burden and also to prevent untimely death. So if you are a leader, you have to provide hope for these workers and also see how you can integrate the work of the health worker and the client. If you are not a good leader, you demotivate these workers and their zeal to work would actually die down. The sixth thematic area of the policy is looking at collaboration with key stakeholders, development partners, and the private sector. And I believe this conference is within this policy framework, collaboration. My first question: why is brain drain a global concern in relation to the health sector? In April 2024, the Ministry of Health, with support from WHO, completed a document on national health labor market analysis. This strategic human resource intervention document revealed that there is no an ideal nation in this world. Every nation go through some kind of difficulty when we talk about health workers. And for that matter, if you go to the labor market, where we talk about demand and supply, we don't have equilibrium. Where we can talk about a nation having the capacity to produce health professionals, recruit all of them, and for that matter, will not look outside the confines of that nation for support. This document, the National Health Labor Market Analysis, indicated that there is the need for health workers in every nation you talk about. Why? Because of disease burden. There's no nation that is isolated or insulated from disease burden. And for that matter, at the end of the exercise, the document came out with 3 principles. That is need, where graduated health professionals are required to address disease burden. We have the supply, where health professionals have to go through training and education to pass out, to acquire the skills. Then the third principle is demand. The willingness of health professionals to accept recruitment. Since there is mismatch in all nations, other nations looking at their capacity may not be able to train the health professionals they want, that is supply, but they have the capacity to demand. So they will go to the global labor market and look for health professionals. because they need to maintain their health system. At the end of the exercise, we realized that Ghana has the potential to play the role of supply. We don't have the potential to play the role of demand because we can't go outside and recruit. Even our own graduates, we are not able to recruit. How much more going outside? So in terms of mismatch, Ghana has the potential to supply. And because of these dynamics between need, supply, and demand, brain drain and brain gain is existing because people will have to survive. If you're a nation and you're not strategic, they will take away all your health professionals and you have nothing to write home about. WHO gave a forecast that indicates that by the year 2030, the world would actually have a shortfall of between 10 to 11 million health workers. And low and middle income countries would actually suffer. From the forecast, it shows that supply can never meet demand. There will always be a shortfall. And unfortunately, Ghana is one of the countries that is currently suffering from the negative impact of this shortfall. Unfortunately, brain drain causes critical shortages of specialized health professionals, resulting in severe impacts on health systems. The health sector is already facing a huge gap in relation to the stock of specialized health professionals, making the situation worse if the global labor market decides to take the few that we have. So as a sector, in 2024, a study was conducted on skills gap analysis. And this study was benchmarked on International Labour Organization ISO 2008 classification of health workforce. The various occupational classes in the health sector were coded, and an occupational class register was developed. In addition to identifying the skills gap, the study also aligned the health professional skills to the skills recognized at the global labor market. Staffing norm developed in 2018 was the baseline of the study. I wish the slides were projected because there are tables that, oh, great. So how does it impact on Ghana's healthcare service delivery? The outcome of the study indicated negative variance among various occupational classes in the health sector. The formal health sector operated with 36.8% of its staff required. Specific occupational classes also show varying differences in their shortages, with the higher professional groups being the most affected. The study showed huge deficits in the availability of specific staff categories, especially the highly technical and professional groups. At the end of the study, we realized that 5,175 facilities that we visited per the staffing norm needed 557,488 appropriate skills to deliver quality health care. But those available were 204,961, giving us a gap of 352,527. If you talk about occupational class, the medical doctors happens to be one occupational class. Within that occupational class, we have various grades, depending on the skill you have. So within the medical doctors occupational class, we have MOs, that's medical officers. Per the staffing norm, these facilities needed 10,341 medical officers, but 4,448 were available, giving us a gap of 5,893. Because of time, I may not be able to go through all the grades. So I'll flip through and move to the last column, which is medical doctors occupational class. The medical doctors occupational class required 22,524, 6,309 available, and 16,215 happens to be the gap. So if you have this gap, and they are also running away, it means your gap is deepening, and your health system will collapse. And that's why we need to strategically maintain what we have, and look at how best we can change brain drain to brain gain. The nursing professional class, 139,408 professional nurses needed, 52,617 available, with a gap of 86,791. The various skills are spelled out in the table. I move to another occupational class, and I'll move to the pharmacists. The pharmacy as occupational class. With the pharmacists, 5,627 needed, 1,332 available, with a gap of 4,295. And even with the pharmacists, if you look at the gap, about 3,172 represents specialist pharmacies that we don't have. So it means if you go to the pharmacists as occupational class, we need to ensure that when we are focusing, the specialized pharmacy should be considered. And like previous speakers indicated, healthcare is teamwork. And that's why the policy, the first thematic area talks about appropriate skill mix. If there is a case and a specialist doctor comes, we should have a specialist nurse, a specialist pharmacy. And these specialized skills will understand the case, and together they can address it. So if your strategy is to focus on one occupational class, then you are not helping the system. It is teamwork. Healthcare is teamwork. One occupational group can never give us what we want. With the biomedical scientist occupational class, 23,399 required. Available, 5,336. Gap, 18,061. These are the gaps that we are struggling with. My last question. What pragmatic solutions needed to mitigate the brain drain in Ghana? The first is multi-sectorial approach is the only way for the implementation of the pragmatic solutions aimed at mitigating the brain drain. And I believe that is what this conference stands for. I also looked at SWOT analysis to understand the strengths opportunities, weakness, and threats of the health sector. And with the strength, I realized that we don't need to reinvent the wheel. We already have National Human Resource Policy established in the year 2020. Can we look at the policy recommendations and bring stakeholders together so that we march along the same path? The policy has given birth to strategic human resource intervention documents, i.e., the National Labor Market Analysis Document, the Skills Gap Analysis Document. These are documents that has been taught through research, but we put them down and start the whole business again. Our strength is to ensure that these documents will be put to use. But it also requires leadership from the ministry. The ministry, who is the custodian of this document, is to provide that leadership so that other key stakeholders can support to address the challenge we are facing. For instance, if you look at the skills gap analysis, all the skills that are in short supply, can we then focus to train to bridge the gap so that it will be national priority? And if we are able to do that, we will ensure return on investment. The report also indicated that when it comes to training, you cannot leave out academia. You can't leave out the private sector and key partners. As a nation, can we identify those who can support, get these skills into our stock so that our health system will be vibrant? The National Labor Market Analysis Document also indicated that we have existing postgraduate colleges for medical doctors, for pharmacists, for nurses, and yet to be established college for the allied health. Can they be engaged to know where the gaps are so that they expand their training sites to ensure that at least we can have increase in terms of numbers? Weakness is our inability to coordinate key stakeholders. And I believe this 11th Biennial Scientific Conference should remind all of us the need to work together. Our other weakness is limited financial space. People are graduates, and like I indicated, Ghana has the potential to supply. But as it exists now, the excess supply is artificial. It's artificial because there's no money to recruit them. But there are vacancies they can fill. And the danger is that when they are not practicing their skill, they lose their level of competency. And I believe it's a threat to our health system. So we have an opportunity to establish bilateral agreement, either short to long term, because the health skill in the global labor market is needed. And we are part of the global labor market. And that's why people will entice our health professionals to leave Ghana to destination countries. So what some of us are recommending is that with the short-term managed migration strategy, let's formalize migration. And look at our payroll. The Minister of Finance is talking about limited physical space. Can we create space on the payroll by looking at the skills that are fairly adequate and looking at their distribution, and per the agreement, ask destination countries that we are giving you 5,000 health professionals or 10,000 out of our 200,000 health professionals on the payroll. So when the 10,000 leaves, the unemployed will enter the system without any additional cost. Because every year when the finance minister reads the budget, everybody on the payroll is budgeted for the whole year. So if you leave, you can be replaced. So if we consciously take some out and bring some in, what we are doing is that we are having return on our investment in the sense that government paid money to train health professionals. When they come out and you don't recruit them and they are losing their skills, you are losing your money. You are also losing the services that they will provide. So to prevent allowing them to sit down for 3 years, only to be recruited when they are not competent enough, because they've lost their competency. Quickly establish this replacement strategy to bring in and send out. Bring in and send out. You can plateau the same budget, but the strategy is that you are sending some out and you are bringing some in. I will not talk about remittances that those you are sending out will bring. I'm not talking about the ripple effect of those who are sending out to their families. This is a strategy. And I believe this conference would actually note it. The long-term strategy is the destination countries. We have identified our gaps. They also need the same specialized nurses. Can you invest by way of sponsorship? That, oh, I'm training 20 specialized doctors in this area. The agreement is that when they finish, give me 5. And there should be post-service bonding. Because if you receive this sponsorship, you have to work for it. If you agree, you are sponsored. It is a global market, so we need to think outside the box. We are part of the global dynamics. If we don't do that, we cannot restrict health professionals not to travel. A health professional cannot be prevented from traveling because he's a health professional. It is against that person's right. So yours is to strategically retain that person to ensure that your system is vibrant. So like I indicated, Ghana has the potential, with the collaboration with other key stakeholders, to increase the skills. And like I indicated earlier on, an unemployed health professional becomes a threat to our health system if you allow that person to stay for 3 years. You see, healthcare is hands-on. The more you are out of the job, the more you lose your skill. So if you allow such a person to stay in the house for 3 years, only to give financial clearance, do you know what you are doing to the system? Anybody who appears before that health professional, you are a guinea pig. He's going to use you to sharpen, and who knows whether you or I will meet somebody who has stayed in the house for 3 years. He will facilitate your death. May God forbid. And because there is no existing bilateral agreement between Ghana and other countries, there's a field day for illegal recruiters. And it is also a threat. People are willing to travel. And there's no opportunity as a government to allow them to travel. Then people will deceive them. Oh, come, pay these huge sums of money. We'll facilitate your recruitment. But you do know the danger. After paying the money, when they get to destination country, they give them semi-skilled jobs. No matter your background, you can be a specialist. You are desperate. The amount of money government has spent on you to develop that skill is lost through the illegal recruiter. And when you get to the destination country, when they say do menial job, you cannot say no. The trap has caught you, and you will do it. And these are issues, if we reflect, we'll be very passionate about managing the human resource. In conclusion and call to action, I indicated that brain drain is a major obstacle in health service delivery. If you look at WHO, system strengthening, it talks about leadership and governance, service delivery, human resource, information technology, logistics, financial. I tell people that all these components in strengthening human resource, the heartbeat of the system is the human being. It is the human being who provides leadership. It's the human being who delivers the service. The human being himself is also a worker. The human being will manage the finances. The human being will manage the information technology. So if you don't manage your human resource well, then you are collapsing your health system. At times when I speak, people say because your background is human resource, so you are too passionate about human resource. I'm passionate because the one even speaking to me, I'm supposed to manage that person. Pragmatic solutions focusing on appropriate health professional skills, development, retention, and system integration is very, very critical. Collective action among stakeholders is necessary to bridge the gap towards universal health coverage. Policy, technology, education, and governance must work in synergy. Ghana must act decisively to transform brain drain to brain gain. Thank you for your attention.
Thank you very much, Dr. Sabri. We'd like to call the Dean of Nursing and Midwifery, Professor Mrs. Veronica Millicent Jomeku, to do us the honors and give the plaque to our presenter. Is she here? Thank you so much as you represent our Dean. A few announcements. Thank you so much. Please take your seats. Our restrooms or washrooms for dignitaries are just behind the stage. And for the rest of the participants, our restrooms are in the basement downstairs. Thank you so much. We move on to our sub-theme 2. And it talks about health systems financing. To address how we can apply innovative ways to finance healthcare provision and delivery in Ghana, we have Professor Dr. Wilm Quentin. Professor Dr. Wilm Quentin is the chair of Planetary and Public Health in the Faculty of Law, Business and Economics at the University of Beirut, Germany. Prior to his appointment at the University of Beirut, Prof. Quentin worked for almost 15 years at the Department of Healthcare Management, Berlin University of Technology in Germany, where he received his formal lecturer qualification in public health in 2017. He is a medical doctor and holds an MSc in health policy, planning, and financing from the London School of Hygiene and Tropical Medicine and from the London School of Economics. He has been a visiting fellow at the Institute of National de Santé Publique in Abidjan and holds a visiting professor at the Kwame Nkrumah University of Science and Technology in Kumasi, Ghana. Ladies and gentlemen, let's give a round of applause to Professor Quentin.
Good morning. All protocols observed. Thank you very much for being here and for taking this long introduction and still being on your seats and awake for, hopefully staying awake for my presentation. Thank you very much also for the predecessor speaker, Dr. Asabir. Thank you very much for talking about financing also as the basis for human resources, and I would say, but that's my special maybe financing perspective on the problem, that a big part of the problem is in fact the financing problem in Ghana, because you mentioned that there are human resources who cannot be employed because of lack of finances and fiscal space. So that's a good transition to my topic, innovative financing mechanisms for sustainable healthcare in Ghana, which is at the source of many problems in the healthcare system in many countries of the world. But that might be my biased view again. I have summarized my main messages for you here at the beginning, so if you do fall asleep in between, that is not a problem. Health financing is political, is the first point. Health financing in Ghana is good, but it can be improved. Innovations can help make improvements, but improvements do not necessarily require innovations. However, financing principles are important, and there are principles of how health financing reforms should be designed and what they should try to achieve, and any reform, innovative or not, should be guided by principles. And finally, Ghana can make improvements by aligning health financing with principles, either supported by politics or maybe despite politics. And this brings me to the start, that health financing is political, and you see here a news clip from Mahama launches Mahama Cares, appeals to corporate Ghana for support. So basically you can see that health financing is at the top level of the political debate in Ghana, and this is not typical for Ghana only, it's the case in many countries. Also in Germany, health financing sometimes reaches the news headlines, and it does also in other countries. And so some say, in fact, that health financing is 99% political and only 1% technical. I would say it's not possible to draw a line, because everything is political, but the politics are played out in the technical details. And so even if you talk about the technical parts, they are political, but the politics are also technical. And that's kind of part of the multidisciplinarity or transdisciplinarity, and that's why research in health financing also always has to reach beyond the scope of academia, because in order to do research and in order to understand what is happening, we have to engage with policymakers, and we are happy to have policymakers in the room here today. Health financing is important because it is important for making progress towards universal health coverage. This is a framework that tries to illustrate how health financing systems that consist of revenue collection, pooling, and so first collecting the resources, then pooling the resources together, and the pooling function is important for health financing systems, that the resources are not spread around multiple different funds, but that they can then be used strategically because they are brought together for the entire population to purchase those health services that are needed by the population, and then to design benefits that are needed by the population and to finance those benefits. And that is the basis for achieving universal health coverage goals, of achieving universal financial protection, because everybody is covered and enough resources are available to pay for the care of everybody according to need, to assure that utilization is relative to need and not to ability to pay. And that is why it is important to pool resources together so that the poor have enough resources for their care based on financing provided by the rich. And that resources and care are used to finance high quality care because enough resources are necessary in order to pay for high quality services, to employ sufficient numbers of staff, but also to buy the technologies that are needed. And now I would say health financing in Ghana is good because it is mainly financed by public resources, or the majority of health expenditures in Ghana comes from government health expenditures. And you can see here that there is quite a high fluctuation, but in 2022, the last year for which data is available, 55% of health expenditures in Ghana came from government resources, which is considerably above the average in sub-Saharan Africa. Also, Ghana has the highest proportion of the population insured by a health insurance scheme in Africa, only after Rwanda. So you can maybe not read the country names, I didn't count on the size of the screens here, but the top country is Rwanda, which has the highest coverage with health insurance in Africa. The second country is Ghana, with the second highest health insurance coverage in Africa. So health financing in Ghana is good. But nevertheless, it can be improved because public spending on health remains below average in Africa. So not as a percentage of current health expenditure, but as a percentage of the GDP that is transferred to the healthcare system. Should I try this microphone? So, and that determines, in fact, the overall resources available, because as a proportion of GDP that is transferred to the health system, public resources are below average in Africa, which determines that of the total wealth that Ghana has, a lower proportion is used by the government for healthcare financing in Ghana. And that also explains why out-of-pocket spending remains about average in Ghana. So it's despite high health insurance coverage and despite a high share of public resources in the current health expenditures in Ghana, out-of-pocket spending remains about average, and that has negative effects on the population, but I will come to that in a minute. In addition, health financing can be improved because spending on administrative costs is quite high in Ghana. So on the left side, oh sorry, please, can you move to the next slide? On the left side, you see data from the national health accounts. So the last year is 2022, when administrative costs in the Ghana health system accounted for about 16% of total health expenditures in the country, which is, and the year before it was even higher, above 25%, which is a very high number by international standards. In Germany, about 5% of total health expenditures are used for administration. Also, when looking more specifically at the national health insurance, almost half of the costs were not used for claims reimbursement, so only 55% of NHIS expenditures went into the reimbursement of claims in the year 2020, which is the last year for which I found data available. And this high level of out-of-pocket spending and relatively high administrative costs means that if the population wants to access healthcare services, they are often still not fully protected, and that leads to catastrophic health expenditures, meaning that people spend more than 10% of their income on healthcare services, or more than 20% even on healthcare services. And the slide on the figure on the left shows that in 2022 it was almost 12% of the population who spent more than 10% of their income on health expenditures, and almost 6% who spent almost 20% of their income, or more than 20% of their income on health expenditures. And this number has in fact increased over the past 10 years, indicating that despite efforts to improve coverage, still a sizable proportion of the population is not sufficiently protected. And sometimes we see that in countries that catastrophic expenditures in fact grow as countries get richer and more health services are available in the country, because when a country doesn't have many health services, also people do not use those health services, and then they don't spend money on health services and don't have catastrophic health expenditures. But as more health services are available, catastrophic expenditures increase. In addition, this leads to inequities in access that remain, that on the right side you see the deciles of the population and how often or what proportion of the decile is seeing a health practitioner in a given year. This is the last data from 2017, in fact, and there only half as many people in the poorest decile of the population saw a health practitioner as in the richest decile of the population. And now the question is, of course, can innovations help make improvements? And there the first question is, what are innovations in health financing? And colleagues from the World Health Organization African Regional Office recently did an overview of the nature and contribution of innovative health financing mechanisms in the WHO African region. And they first defined what an innovative financing mechanism is. And they say it has to be something that assures additionality, that the new mechanism must complement existing financing without crowding out other existing financing resources. Also, a new mechanism should be effective. It should ensure the right or the better use of additional funds for the financing of the healthcare system. And it should be an efficient mechanism, that the new mechanism contributes to value for money by raising resources that then also lead to effective expenditures in the healthcare system. And the different innovations that they identified are quite a large number of different taxes: tobacco tax, alcohol tax, airline levy, sugar tax, oil, gas, and minerals levies, financial transaction tax, mobile phone tax, and then some funds like an HIV/AIDS trust fund, a social impact bond, and an equity fund. So in principle, increasing taxes, in particular on things that are bad for health, does have an inherent rationale and can explain why this should finance health expenditures. And in Ghana, this is in the middle more or less, I'm not sure if you can see it here on the slide, has only tobacco tax and alcohol tax explicitly to use to fund healthcare services, but other countries use airline levies, sometimes through the UNITAID initiative, or oil, gas, and minerals levies through the Unit Life initiative, which are international bodies that can also help facilitate the channeling then of these resources for specific technologies, as the UNITAID is sometimes used for the financing of vaccination production or domestic technologies, and the Unit Life mostly for financing services against undernutrition of children. But also financial transaction taxes, for example, on remittances or mobile phone taxes are used in the Gambia, in Gabon, to finance a sizable proportion of health expenditures. Another way to raise additional revenues is through digital innovations, and multiple countries in Africa are using digital innovations, often to replace out-of-pocket payments through mobile wallets. But in Ghana, in fact, in a recent project, the REACH UHC project that we had the honor of implementing together with the National Health Insurance with funding from the German Ministry of Education and Resources and Research, we developed an intervention that includes automatic renewal and reminders to renew the health insurance as it expires annually, and then to help the population to remember that they are supposed to renew their health insurance, or to sign up for automatic renewals so that their health insurance is automatically renewed at the time when health insurance expires. And this is an intervention, and Ghana has made quite a lot of digital innovations in health financing in recent years that are also interesting for other African countries, where they look at Ghana to see what they can learn from digital innovations in health financing. However, it's not only about raising revenues for health. Pooling reforms or innovations are important as well, because it's not enough to raise resources, for example, through digital mobile wallets, if then the money is used by individuals. Money has to be pooled together, and fragmented pools are an important problem. And as the private health insurance, voluntary health insurance market has in fact increased in Ghana, the cross-subsidization or merging of health insurance funds is something that can also lead to additional resources in the public health system, or by using cross-subsidization from VHI to the national health insurance to increase and shift additional resources to the public system. Another option is to enforce NHIS membership for voluntary health insurance members, potentially also facilitated by the automatic renewal system, or to pool resources from the Ministry of Health and the NHIS, because currently these two fragmented separate pools also create certain problems for purchasing of healthcare services. That brings me to the third part of financing, the purchasing reforms or innovations. And again, colleagues of WHO African region have recently conducted an overview of what all African countries are doing in terms of purchasing reforms. And one area that many countries are engaging is in the specification of services that should be available free of charge to the population. And Ghana is also falling into this category with the prioritization of primary healthcare services. In addition, many countries, 17 countries, are engaging in blended payment systems where they include capitation and other fee-for-service payments, for example, or performance-based financing for primary healthcare services in order to provide a more balanced set of incentives that encourages providers to provide the right kind of services to the population. So while these are reforms or innovations that are undertaken by different countries, I say innovations with a question mark because many of these things are in fact not new, but they require political will to increase taxes and to convince the population of the necessity to add additional resources for the health financing system, or to increase the priority given to health, or to merge resources from private resources to public resources. And in fact, therefore, reforms that are undertaken should always be guided by principles. And these principles, as specified by the World Health Organization, are that revenue raising should aim to move to its predominant reliance on public funding sources, which should be raised progressively. That means according to the ability to pay of the population, that not everybody should pay the same amount, but that those with higher ability to pay, with higher incomes, more resources, should contribute more to the healthcare system than those with fewer resources. In addition, it is important to pool resources together to reduce fragmentation and to enable solidarity within healthcare access for the population, and to mitigate the consequences of fragmentation through cross-subsidization from different pools. And finally, with regard to purchasing, it is important to move towards more strategic purchasing of health services, which means to think strategically about what are the services that should be available to the population, to focus resources on those services that provide the greatest benefit to the population, like primary healthcare services, and to make use of incentives and link payment to population health needs and performance to make sure that the resources are also used as intended by measuring the performance of the providers or by linking payment to certain activities, and to align coverage policies with policy objectives. So that already brings me to the end of my presentation, that health financing is political. Health financing in Ghana is good, but can be improved. Innovations or reforms can help make improvements, but improvements do not necessarily require innovations. Financing principles are important, and any reform, innovative or not, should be guided by these principles to move towards greater reliance on public financing, to pool resources together, and to use resources strategically. And Ghana can make improvements by aligning reforms with health financing principles supported by politics, if the politics also aim to achieve these principles or despite politics. Thank you very much for your attention. And as a final remark, in health financing, as in most things in life, in fact, reforms are rarely as good as you hope, but also not as bad as one may fear. And I also wanted to bring the attention to a policy brief published by the World Health Organization a few years ago already on free healthcare policies, opportunities and risks for moving towards UHC, why free healthcare can be good, but also what the challenges are and how it can be risky to engage in free healthcare policies. Thank you very much.
Thank you very much for that useful presentation. Please, can you stay here as we welcome Professor Idrissa Akwadie to present a plaque on behalf of the organizing committee. Please, a round of applause. And Prof just whispered that he's his former student. So this is a very memorable picture. Please, a round of applause. Thank you very much. And we continue. Please keep staying alive as we move into the next theme, health information management systems. The topic that is going to be presented on is digital health and health system strengthening, lessons learned from the National Electronic Medical Record Systems, EMRS. And this presentation is going to be made by a skilled senior specialist pharmacist in endocrinology with over a decade of experience in clinical pharmacy and public health at the Komfo Anokye Teaching Hospital, Ghana. With a background in clinical pharmacy and a passion for patient care, ladies and gentlemen, our presenter is dedicated to safeguarding patient safety and ensuring positive patient outcomes. Shall we, with a round of applause, welcome Dr. Margareta Odame Entry. Please, a round of applause.
Thank you, Princess. Good morning to you all, distinguished ladies and gentlemen. Professor Chair, with your permission, I'd like to stand on the existing protocols already observed. In bridging the gap and ensuring that everybody, every Ghanaian in every corner of Ghana has access to quality health care, there's the need to digitize our health sector. So what is digital health? So digital health is the use of information and communication technologies in medicine and other healthcare fields to manage health risk, treat diseases, and to promote general well-being. So this was supported by the World Health Organization. So in the year 2010, the government of Ghana, through the Ministry of Health, launched its first e-health strategy to advance healthcare delivery through the use of information and communication technology. This was supported by the World Health Organization, the International Telecommunication Union, the Novartis Foundation, and there a need for an electronic health record system as a core policy priority was identified. So the aim of the e-health strategy was, one, to define a robust system for the use of information technology to capture, store, and exchange health information to improve patient care services by providing a continuum of care. This also puts in place a coordinating system for reviewing and aligning new information and communication technology in healthcare. The goals of the e-health strategy was, one, to improve health outcomes whilst leveraging technology, increase access to care, bridging the equity gaps, expanding care to everyone in Ghana here. It was also to enhance healthcare efficiency whilst minimizing costs, the limited resources we have available. It was also to eliminate inefficiencies inherent in our manual records whilst improving healthcare delivery. Then, it was also to enhance data visibility that can strengthen the public health by establishing early warning systems for disease outbreaks to boost coverage of public health interventions. Now, let me tickle your imagination as I take you through the paper-based record system that was previously being used. So Komfanochi Teaching Hospital has 13 independent clinical directorates, for which I term as 13 district hospitals on one land. It has 2 non-clinical directorates and 20 supporting units. So previously, this was the paper-based medical record system being used. So let's take Madam AB, who would visit the hospital for specialist care. As a woman, if she had an issue in OBS and gynae, she would be given a white folder with a different patient, with a new patient number. This same woman, should she have an issue with her eye, will be given yet another green folder with a different patient number. Now, Madam AB, should she also have a medical condition and referred to see an internal medicine specialist, will be given another folder, which is colored red, with a different patient number. Now, the last one was used usually at the OPDs or at the dental clinics. So now we have Madam AB with 3 different folders, 3 different patient folder numbers with scattered health records. Now, so the importance of integrating technology in healthcare systems is to streamline healthcare operations, optimize workflows through the EHR, whilst we enjoy positive patient outcomes and protect the public purse. So with the description before, you can imagine some of the disadvantages Madam AB can face. Now, having seen all this, Komfanochi Teaching Hospital decided to delve into digitalization. In the years 2007 and 9, we adopted the use of the Medical Pro, which was used for the patient's registration and an upload of medications prescribed for patients. Now, with the advent of the health insurance, there was a need to raise claims and submit claims for reimbursement. So the Hospital Administration Management System, popularly known as the HAMS, was adopted between the years 2009 and 2018. This was used for patient registration, OPD consultations, prescribed medication, and of course, health insurance claim processing, then patient payment as well. Currently, the Lightwave Health Information Management System is what is being used in the hospital. This is popularly called LIMS. So you see, in Komfanochi Teaching Hospital on the LIMS, we currently have over 1 million patient folders and over 9,000 registered users. So imagine storing 1 million patient folders in paper. See the space that it can occupy. And having said this, at a glance, you can see that between March 2018 to date, you can say that 9,000 or over 9,000 health professionals have been trained. And I am proud of the team that have helped train these users on the use of the EHR. And I have the rest of my team amongst you. So how does the EHR used in Komfanoti Teaching Hospital work? It's got interoperability properties such that it can link with laboratory analyzers, X-ray systems, government project interfacing, National Health Insurance client validation, claims processing, and the claim IT. It's able to also integrate with banks. So how is this explained? Now, with this interoperability, this means that now Madam AB, with her 3 folders, now has just 1 folder. And should she have any laboratory test requested for her, at a click, the doctor will have it on his interface. And with all the 3 clinics that we saw her going through, at a click, the doctor can see all the consultations that were made for her in real time. So it helps in continuity of care. It also has telemedicine capabilities. So patients outside Komfanoti Teaching Hospital in other peripheral facilities, folders can be seen. So whilst you engage your patient here, if there's a need to give care for the patient and the specialist is located in any part of the country or even the world, you can call in and the folder can be shared for better patient outcomes. What are the key benefits of this system for hospitals? There's improved efficiency. So there's limited paperwork, which minimizes delays by digitizing patient flow and clinical documentation. There's better coordination amongst clinicians. There's cost control. For example, duplication of laboratory tests is a thing of the past because at every clinic, at a click, you are able to see reports of every laboratory test that have been requested and done for the patient. It also improves accountability, where hospital managers at a click can monitor activities in real time. What does the patient stand to gain with this? There is continuity of care, which cannot be overemphasized, because patient histories are accessible across all facilities, ensuring accurate treatment at any point of care. Faster services in registration, prescription processing, etc. There is also safer care because of the electronic prescribing, so duplication of prescriptions can be monitored and managed. There are also clinical alerts on the system, which enhances the patient's safety. Now, the patients are also empowered because there's transparent billing and consistent records, which improve the trust of the patient in the healthcare system. Now, nationally, data can be aggregated such that diseases can be tracked and conditions in real time. This will enable early detection of outbreaks, such as malaria, the COVID-19, and which will enable rapid public health responses. So there is now data-driven alerts, which will help policymakers and managers allocate resources more efficiently while strengthening Ghana's contribution to global health security. So this is an example of sharing patient data in real time. So can you blow it up a bit? So this is a live patient who was seen last week. This patient was referred from Holy Family Hospital, Brekum. So the external folder or report from the peripheral hospital was pulled onto the Kwame Teaching Hospital's interface. And from the screen, you can see that we have discharge reports for the 2nd of September and even as far back as the 26th of June. So having looked at this, the doctors or clinicians can better take care of this patient because they will know what was done for this patient in the peripheral hospitals. There's enhanced data management and reporting. At a click, managers can see laboratory tests that have been done for patients and the commonly requested lab tests in the hospital, the number of discharged patients, even the conditions that are commonly admitted in the hospital, unpaid bills, bed turnover ratio, etc. This is yet another manager's dashboard. There are several managers' dashboards. For this especially, it's called the CEO's dashboard. So at a click, you can see your revenue in the hospital. So you can see revenue coming in from OPD and the IPD. Now, the orange color you see is revenue from NHIA, or patients who accessed healthcare with the National Health Insurance cards. The blue one is patients with cash, and the total is the green. So what are the lessons that have been learned from all that I have described? So there is the need to upgrade our infrastructure. So network infrastructure, which entails high-speed connectivity for the LAN, and one with supported wired and wireless devices. There's the need to acquire workstations and client devices, such as desktops, laptops, peripherals such as scanners, barcode readers, which will enhance users with their work, servers and data centers, where storage capacity configuration in the cloud and even local are available, disaster recovery and business continuity plans for regular backups. There is also the need for security infrastructure, data encryption, access controls, firewalls, amongst all. Now, there's a need for also training and capacity building for staff to maximize the EHR. I think currently, almost every student, almost every user has a basic knowledge in ICT, but navigating through the EHR is a skill that needs continuous training for all healthcare workers. And there is also the need to customize the electronic health records workflow to fit the user's work processes and needs to increase adoption. Because when it veers so off from what they are used to, they find it difficult or challenging using the EHR. There's also should be the provision of technical support and user feedback channels so that when users have any challenges, they can count on support. There's the need for standardization of clinical data capture, because as we have demonstrated earlier, there's the availability of patients' data across the facility and even the entire country. So standardizing it makes it more acceptable. And we also encourage collaboration between healthcare professionals, clinicians, IT, finance, etc., so that everybody adopts it as his or her own, and not that EHRs belong to the IT team or just the finance or any other professional. There's a need to advocate for policy reforms that support EHR-driven processes. In Kwame Teaching Hospital, we ensure that certain processes goes through the EHR. For that reason, most of our processes, about 93% of it all, goes through the EHR. We also need to embrace technological advancement to stay ahead in healthcare system, because worldwide, that is what is being used. So the use of AI, etc., can be adopted to advance EHR. There's the need to expand access to care whilst reducing operational costs. The use of telemedicine, it eliminates geographical barriers to care, where patients, no matter where they are, can also receive the best care from the best specialist, because your folder is right there and there with you, and it can be seen and accessed by everyone. This will reduce operational costs that's associated with physical infrastructure, and it also increases efficiency in healthcare delivery and resource utilization. Data security. It's a practice where data or information captured on systems is protected through its life cycle. So there's the need to ensure confidentiality, integrity, and accessibility. Patients must feel and know that their data captured is kept confidentially. It's also available for whoever needs to use it, and is the right data that is being captured. It's been observed that in most hospitals, users feel that the EHR is a government-owned enterprise, so they shun away from it. So it is also about time that users will own, or hospitals will own, the EHR and manage it to suit their practice whilst ensuring positive patient outcomes. So in concluding, I'd like to say that it's important to implement workflow automation to improve patient throughput, also enhance EHR interoperability to facilitate seamless data exchange, invest in staff training to maximize the EHR utilization and efficiency, and continuously evaluate and refine the processes to meet evolving needs. Thank you so much for your attention.
Thank you so much. So many lessons, so many takeaways. We would like to thank Dr. Margaret Odami-Antwi, and we would invite Professor Nkrumah to make this presentation on behalf of the Conference Planning Committee. He is the conference chair. Thank you. Thank you very much, Prof, and thank you very much, Dr. Mrs. Margareta Odami-Antwi. Before our final presentation, we would like to stand up briefly. Please, let's be on our feet. Walk to 2 or 3 people. It's a brief networking session, so that we would come back to our seats. Walk to 3 or 5 people. Get to know someone. And we will be seated in the next seconds. By now, you should have met 3 people. Thank you very much. You should have met the 5th person. Please, let's be seated. Thank you very much. Please, let's get back to our seats as we listen to our final speaker. Okay, thank you very much. Thank you, thank you, thank you. Thank you very much. Please, 30 seconds more. 30, 29, 25, 20, 15. Thank you very much. Thank you very much. It seems the networking session would continue, but it would continue after or during the poster session. So please, let's continue. Thank you very much. We would like to acknowledge a few more dignitaries in our midst. We have the former Pro VC, Professor Charles Ansah. Please, Prof, we acknowledge you. Please, a round of applause for Professor Charles Ansah. We have the Dean of the School of Public Health, Professor Peter Ejay Bafo. Thank you very much. We have Professor Alexander Debra, the Dean of the Faculty of Allied Health Sciences. We have Dr. Kingsley Ayi, Registrar of Veterinary Council, Ghana. Thank you very much for making it. We also have the Director of Student Affairs, Professor Marianne Nkansa, in our midst. Please, let's welcome her. Thank you very much. And now to our final presentation for today. Our speaker is a multidisciplinary specialist with advanced leadership and technical skills in digitalization. He is a director of research statistics and information management at the Ministry of Health. He provides lead to digital transformation of Ghana's health sector and is responsible for advancing the practice of data-driven decision-making in the sector. He is also responsible for setting up a sector-responsive research agenda covering diverse areas such as climate change in health. Ladies and gentlemen, our final speaker for today is Dr. Wisdom Atiwoto. Please, shall we welcome him? Thank you very much for making it.
Thank you very much. Put me before, just before lunch, when everybody's tired. So I'll do something different. So the previous speaker spoke extensively about an electronic medical records we popularly call LIMS being implemented in Kopanochi. But I want to step back a little. So let's jump the next slide and go to the third one. Where did it all start from? I would say the digital health imperative. Where did it all start from? It didn't start from Ghana, but there were two landmark publications by the Institute of Medicine that formed the foundation for the inclusion of digital health as a critical health intervention. And these two publications are what is called To Err is Human, that involved building a safer health system. This publication prioritized quality care and also identified digital health as a solution for health service delivery. It shifted focus from blame to system design. Then the second document talked about, we call it crossing the quality chasm. It emphasized the need for us to focus on 6 areas for quality improvement. And these are safety, effectiveness, patient-centeredness, timeliness, efficiency, and then also equity. So digital health tools digital health tools were identified as indispensable enablers to achieve these aims. So when you are thinking about digital health and all that, you don't want to forget about these six broad quality improvement areas. Let's see what happened in Ghana. Of course, we've talked about the Ministry of Health vision of providing or having a healthy population for national development. And then we actually going ahead to look at the areas where we can focus our attention. And there are 4 broad areas at the ministry: digital transformation of health service delivery, data-driven decision-making, evidence generation and use, and also development of talent. So I'll just jump from that. But in Ghana, there are 3 key drivers that have shaped the adoption of digital health in our health system. The first one is government of Ghana's actions. There have been massive investment in infrastructure. Connectivity has improved, bandwidth has increased. Mobile telephony has gone high. In fact, in Ghana now we have 113% mobile phone penetration. What it means is that there are more mobile phones than human beings in Ghana now. The ministry itself has also taken a few actions and all that. What has been the ministry's response? So in 2005, it started way back in 2005, where the Ministry of Health developed the first health sector ICT policy and strategy. So what it means is that the Ministry of Health, long ago, decided to implement digital health. Then in 2010, the National E-Health Strategy was developed and launched. In 2019, please, next slide, please. In 2019, a major decision to invest heavily in electronic medical records was taken. So we had the EMR system we call Lightwave coming up. And around 2025, based on the lessons learned, we decided that we'll have to develop a digital health policy to shape the process. Currently, this was given to a private company, not government company, a private company called Lightwave. Please, next slide. Yeah, good, next slide. So the contracts started from 2019. It was expected to end in 2022. And as we speak, about 78% of the work has been done, and about 76% of payment have been made. So that is heavy investment from government side. The objectives are many. One of them is to digitize manual patient folders at all public health facilities in the country. The next one is to harmonize and streamline electronic medical systems in the public sector. It was focused on the public sector. And many others. What were the deliverables? About the next slide, please. So the target was to automate or make paperless all the teaching hospitals. That has been done. All the regional hospitals, that has been done. All the district hospitals, that is largely done. All psychiatric hospitals, 2 of them, they've all been moved onto the Lightwave platform. All polyclinics, that has also been done. Health centers, about 30% has been done. So in all, there are about 461 hospitals which have been moved onto electronic medical record systems. If you look at the documentation or the publication from the Institute of Medicine, the focus is supposed to be on 5 key, anybody who wants to do implementation of electronic medical records, we're looking at 5 key outcomes. So what are some of the lessons? I'll give just 4 so that we can go break early and go for our lunch. The first one, lesson 1 is that there have been efficiency gains. Please, don't show this slide yet. Okay, good. So the age-old problem of missing patient information is largely removed. That is good. I think we can clap for that. Revenue generation has improved and leakages blocked. Some processes have improved waiting time, especially at records and some of the other service points. This is also good. Now, a lot of data is now generated, so researchers have opportunity to get data to do their work. Then critically, very critically, the health system has become very comfortable and is very friendly towards the introduction of technology. I think we have done well as a health service. We can clap for ourselves again. Next slide, please. Okay. The enabling environment to deploy electronic medical records to this large number of hospitals is not a simple task. But there was some enabling environment that allowed that to happen. Leadership. There was a lot of leadership direction from the ministry, the Minister of Health at that time, and even now. Finances. Finance was provided. In fact, dedicated funding was provided for the Lightwave implementation. 2 sources, Ministry of Health, direct GOG, budgeting and allocation, and then the National Health Insurance Fund allocation. So it means that money needed for it was provided. No 2 ways about that. That is good. Health workforce. Lightwave came at a time when the average age of the health worker was lower. Most of these health workers, when we were in medical school, the first time I got access to a computer was in the final year when I had to do my community health research. But a lot of the health workers now are computer savvy. They have digital literacy. So that was a good enabler for adoption of digital health. But the question that we need to ask ourselves is that with all this heavy investment and all the success stories that the previous speaker came to talk about, have our health system been transformed? I think you can help me with that answer. Is our health system transformed? Have you seen transformation in the area of the 5 key things I mentioned? Safety, patient-centeredness, effectiveness, equity, and others. Have we done that? We don't know. Or we don't want to say. So give me the next slide. So one of the days when I opened my machine, my computer, and even on the radio, I saw this screaming headline: "CAT goes paperless." At that time, that was what everybody was talking about, managers were talking about. The destination was what? Paperless. And that is where I think we made a mistake. We are talking about lessons learned, isn't it? That is where the mistake was made. The vision we crafted was problematic. Was it paperless or targeting the areas for the improvement? This is a research community, so I can feel free and talk about some of these things. What was our focus? Was it paperless or targeting these areas? So let's see what the data says. And forgive me if I use Confanochi. I know my friends are here. The former CEO, the current medical director, they are all my friends, my brothers actually. But forgive me. Let's look at one critical indicator of our health system performance: maternal deaths. So, Confanochi, this news article was on the 14th of August, 2020. Confanochi goes paperless. Let's look at the maternal death numbers. This is 2020. Let's look at 2021, 2022, 2023, and 2024. At Confanochi. If you look at the color, Conference is the red one, isn't it? So you expect that when you introduce electronic medical records and you have data, she said that you can see data from other hospitals, include those who are sending data to you, referring patients to you. On the CEO has a dashboard, you can see everything. And yet, we are having this. What is the issue? And I think that is what researchers like you can help us uncover. You can help us refocus. You can help us understand. You can help us explain, and then so that we can make good progress. Let's look at another lesson. And I can say on authority that during the implementation of LightWave, patients were ignored. Previously, when it was paper records, when you see your folder, you give you your folder to take to your consulting room, you can pip the prescription. You can pip the diagnosis. But now when you are asked to go to the next place, how do you go with? Nothing. If you are lucky, the doctor will share the information with you. But I personally have had the unpleasant experience of taking my domestic help to the hospital. Went to the hospital, went to all the points, went to a consulting room, went to the labs, went to pharmacy. Then I go home and then the lady of the house asked, so what did the lab say? And I was taken aback because truthfully I didn't know the details of the lab. And that is for me who is a doctor and who is also into digital health. So how many patients have that experience? So even though the data is for the patients, they can't see. If they are lucky to ask, they can have. But they can't see. They are walking in the hospital blind. And if the doctor is, you're lucky, the doctor is not overworked, he will share the information with you. One thing that has also happened is the doctor-patient relationship. You go to a consulting room, the doctor is busy typing. He's asking questions, he's not even looking at you. It's not only Ghana, it's the world over. What can we do about that? And these are questions that, as researchers, we should be crafting very smart research questions to answer. Then, I use a smartwatch, so it records my pulse throughout the day. Sometimes I even sleep with it to record my sleep. I share it with the manufacturer of the watch. All the data goes to the manufacturer of the watch. But if I should go to hospital, I have my pulse data 24 hours. If I should go to the hospital, it will only what will be used will be the one that the nurse took at that time, just one point. The tracking is lost. I wish I can add, and I'm sure many patients would also do so, wish we can add some of the clinical data or personal data that we generate on our own, can add it to what the doctor reviews to make a decision about our health. So again, this is one area where we should be thinking around in terms of research and others. The last point, 4. Health workers said, I'm just quoting, that they don't feel adequately involved in the LightWave implementation. What should we do? How can we improve engagement? It's not just technology, even in policy, the other policies that we do. And I'll give another example. I went to Kolebu with a patient, and they asked a simple procedure covered by health insurance, but they kept saying we should go and pay for something. So I asked the nurse, have you heard of UAC? And the answer was no. So it means that the policy, and I realized, I sat there and I thought about it. We actually champion UAC, we sing it, we shout it, but the health worker who is supposed to implement it is not aware, or is not adequately aware. So just like UAC, just like LightWave, let's improve on engagement. That's the lessons we have learned, one lesson we have learned from the LightWave issue. So I said 4, so I'll end it. There are many more lessons, but 4 is enough. So what I want to say is that although all the key ingredients for a digital transformation of our beloved health system, what we wanted, was present at the time of Lightwave implementation. And although the technology itself was not bad, and yes, there were a lot of efficiency gains, we still have a lot of gaps in our drives towards digital transformation of our health system. So what would I suggest we do? So what we are saying is that our inability to achieve all the desired health outcomes, even with the heavy investment in the Lightwave, and the Lightwave investment was heavy, due to poor patient and health worker engagement. And then these showing that our envision was flawed from the onset. I would like to say that all of us as academics, professionals, policymakers, we have to move beyond mere technology deployment and rather move towards a human-centered design approach. This will involve co-creating solutions with end users and prioritizing interdisciplinary research. And that is why a forum like this is very important. For service design, we need to begin to think about, we talk about patient-centeredness, but the how-to, we are not doing. For service design and the behavioral science, we need to deal with, one expression that I hear a lot in our health system is attitude. These are all behavioral stuff. We need to go deep into them and ensure that future digital health solutions and initiatives are genuinely adapted, sustainable, and effective in Ghana. What I want to say in conclusion is that digital health, though it uses technology, is still a health intervention, so must be necessarily tailored to solve our health problems. Thank you very much.
Thank you very much. That was a very profound statement. Digital health is a health intervention. Dr. Otiwuto, please can you stay here with us on stage as we welcome the Deputy Director of Christian Health Association of Ghana, Dr. James Dua, to present this plaque. We deeply appreciate, and this is from the Conference Planning Committee in appreciation of the role you have played as speaker. Thank you very much. Please applaud him. Thank you. We are almost getting to the end of our opening ceremony, and we would like to welcome the chair of this ceremony, Professor Yao Edusa Akodie, to give us his closing remarks. Please, let's welcome him.
Thank you very much again. Standing on existing protocols again. I wish to thank all of us for being good listeners and for taking part wholly in this morning session of the conference. We have heard a lot from all our speakers who have come up with some solutions of some sort in all the things they have addressed. But many of the things that have been addressed really look like some of the solutions. We sort of know them already. This issue about brain drain, what to do. Yes, the innovations mentioned are good, but just that we know what to do. Have we done them? Okay. We've always said in Ghana that the policies are there, we have the laws, etc. Our problem has always been implementing these. When Professor Quentin talked about health financing, one of the things he mentioned that these innovations are not new. So that, in other words, it demands probably good leaders or the political will to implement these. So in other words, they exist. Okay. So I'm just asking myself, as researchers, we need to do what? Look for the obvious in research and say that this is what we can do. Some of the things, yes, but some of the things, the solutions we'll come up with probably are there already for us to learn from and implement. I wish to thank all the speakers for the session this morning. There's been a lot of food for thought, and it is my hope. The Provost mentioned that he hopes that in another 2 years, when we meet, we'll have been able to implement some of the things addressed at this conference. Let us see how best we can do this, because all this will definitely support our health system and improve healthcare in Ghana. I'll come to another issue that is very dear to my heart. The college planning, the conference planning committee, led by Professor Nkrumah, discussed with the editorial board of the Journal of Science and Technology of the university that work out to bring up proceedings and abstracts from this conference into a booklet. We are working on them to do that. The Journal of Science said that will be something that is new also in this university. So thank you for that. The Journal of Science and Technology is the university's academic journal, publishes manuscripts on biomedical sciences, engineering, physical sciences, naming anything that occurs here. It suffered some delay in publications. In 2022, the Vice Chancellor set up a new editorial board, and I'm the editor-in-chief of the editorial board. And we've worked very well though we don't have any papers currently that are outstanding. Okay. When we took over, just published twice a year, okay. But we needed to have the trust of people to say that, look, we will take in what you bring and publish them. So we started receiving a lot of manuscripts. So we moved to 3 times a year. Now we do 4 times a year in March, June, September, and December. The September issue is out. It is online. We've gone online as well. So before the hard copies come out, everything is online. And currently, we are doing very well because we are getting a lot of manuscripts, not only from mostly from the university, but also some from outside the university and outside Ghana in general. An issue has about 10 manuscripts in it. Currently, we have enough manuscripts for the December issue, plus the 2026 January issue. Okay. We have about 200 manuscripts in the review and editorial process currently. Receiving articles to decision making is about 12 weeks. Okay, we have reviewers in the university and outside who are supporting us in the process. Okay, I said about 200 manuscripts in the system with a rejection rate of between 10 to 15%, depending on the specialty it is coming from. We will still continue to have many journals. So I introduced this journal to you. We have a desk outside here for people who want to support us with reviewing, and also for people who have manuscripts that they want us to have a look at for them. Guidelines to authors are in the journal. Because we are churning out many articles, we've gone online as well. So before we print the hard copies, okay, all the articles are already online with DOIs that you can cite, okay? So you don't have to wait till the hard copy before you can cite your article, okay? And in the university here, these articles in these are accepted as part of our promotion. We belong to the Africa Journal Online stable. That's a stable that indexes all journals from Africa, okay? When we took over, just was rotating between 0 and 1 star out of a possible 3. We are now a 2-star journal on AJOL, okay? And we move further to so that this will be made fit for purpose. On AJOL, the articles will continue and they'll appear through Scopus and other databases. We were invited by Scopus last year to apply to be indexed. The same with the Director of Open Access Journals. We are working on that. We want to be seen directly in AJOL, directly in Scopus, directly in other databases than going through the Africa Journal online way. These are some of the things we want to do as a journal. So I introduce it to you and hope that you will patronize this journal. On this note, thank you very much again, participants and speakers. I think we'll adjourn for the next session. Thank you.
Thank you very much. That is a chairperson who can pitch very well, and he's done justice to pitching about the journal, the KNUST journal. Thank you very much, Prof. We would like to acknowledge Professor Kingsley Appiah, former Vice Dean, KNUST School of Business. Thank you very much for making it. Still Vice Dean. Okay. Thank you very much. We acknowledge your presence. And now we would like to call on Dr. Lauren Salah to give us the vote of thanks. But please, after our closing prayer, we still have other sessions and announcements would follow. Thank you very much. Please, let's acknowledge her.
I thought after the chair had thanked us, I wouldn't have to do that. So I'll say good afternoon to this honorable house, the chairman, Professor Yawedu Sarkodie, with all protocols duly observed and already acknowledged. On behalf of the Provost of the College of Health Sciences, Professor Christian Ejari, the chairman of this conference, Professor Nkrumah, and his entire organizing committee, I'm really privileged to give the vote of thanks at the close of today's proceedings of our scientific gathering. First and foremost, I would want to extend our heartfelt gratitude to our distinguished keynotes and sub-theme speakers, whose insights are thought-provoking and have not only sparked our curiosity, but also set the tone for rigorous inquiry, laying a strong intellectual foundation for the rest of the day and tomorrow, and also for a meaningful dialogue for the rest of the conference. Your contributions have set the right tone for this conference. We also extend our gratitude to our chairs who have steered this opening ceremony, and our beautiful MCs who have moderated this session smoothly. Your thoughtful engagements have ensured that every voice is heard. We are also deeply grateful to our sponsors and institutional partners for their generous support. Your collaboration is what makes events like this possible, and your support reflects a shared commitment to advancing health sciences and improving lives through research, education, and collaboration. Your generous contributions has made it possible to bring all of us together and to accomplish all that we set to do as scientists and scholars. We are highly indebted to the organizing team, every volunteer, and the technical teams who have worked tirelessly behind the scenes. Your meticulous planning and tireless behind-the-scenes work has ensured that today's session has run smoothly and professionally. Your dedication is truly appreciated. Finally, to all our esteemed guests and participants. We are grateful for your response, encouragement, and enthusiasm. Your active involvement today is actually a testament to the vibrant scientific community we are building together. So let's carry forward the momentum from this opening ceremony into the main conference, which forms the rest of the day and tomorrow, with open minds and collaborative spirits. Thank you once again. We look forward to an inspiring and productive conference ahead. Thank you very much.
Thank you so much, Dr. Sala, for your inspiring words. All right, so before the closing prayer, we have a few acknowledgements and announcements to make. We'd like to acknowledge our sponsors who have contributed to making this biennial conference a success, and I would like to mention their names. First, we have Blue Skies Ghana. Thank you so much. Thank you to Noda Hotel. Thank you to the Bank Hospital. Thank you to Life Chemist Limited. Thanks goes to B Dental Clinic. Another thank you to Ozone's Chemist Limited. To Lord K Pharmacy and Crush, we say thank you. To the Pharmacy Production Unit, KNUST, a big thank you to you. To COA or COA, thank you for your sponsorship. To the Pathology Consultancy Services of SMS, thank you also for your sponsorship. And lastly but not the least, thank you to New Shore Dental Consult. Now let's please pay attention to these announcements. After we are done with the closing prayer, there will be a photography session, a short one, where we'll have our dignitaries, our invited guests, our directors, deans, provosts come upstage and take a group photograph. After which we'll take another photograph with our partner organizations, with the provost and senior management. Then we'll also take a picture of the planning committee for this year's conference. After the photography session, we would all move next door to the Sarah Mensa building for the opening of the poster exhibition. So all of us. So those at the back who use the doors at the back, and our dignitaries will use the doors behind the stage. After opening the poster exhibition, we'd go to the basement for our snack break. And this is from now till 1 p.m. So we have about 10 to 15 minutes for our snack break. The afternoon session starts at 15 minutes past 1. And these are breakout sessions. So depending on your area of specialty or interest, you may join any of these breakout sessions. Our themes for today are governance and leadership, and this will be in the Block D Auditorium, Class A1. So look out for A1. For those interested in health information management system, you would go to Block D Basement or A2. For those interested in health services delivery and One Health, you would go to BF03 or look out for B1. For those interested in health systems financing, you would go to Block C Auditorium and look out for the letter B and the number 2. For those interested in health workforce, Block AFF09 or C1. For those interested in medicinal products, vaccines and technologies, Block A, TF07 or C2. So the afternoon session, the first part of the afternoon session is from 1:15 till 2:30. And then there'll be a lunch break for 1 hour. So lunch break is 2:30 to 3:30, and lunch will be served at the basement of this very building. If you want free Wi-Fi to use, you can sign up to Wi-Fi and you see CHS Biennial Conference, 2025. And the password is capital letters CHS at 2025. So these are the announcements we have for you. For the closing prayer, we'd like to call Reverend Sister Professor Frances Emily Owusu Ansa. Ladies, please give her a round of applause.
May I respectfully ask that we stand and give thanks. Our Almighty God, we thank you for a successful opening of our conference. We are grateful for how far you have brought us, even as we entrust the rest of today into your loving hands and tomorrow also. We ask you to gift us with wisdom and courage and passion for learning, so that we may be able to grasp what we learn here and be motivated to use the information to find solutions for a good health for ourselves and beyond, and for our well-being, so that we may continue to serve you, for you live and reign forever and ever. Amen.
Thank you so much. Make a new friend, talk to a colleague, have some collaborations before you leave. I'd like to invite, yes, our dignitaries to come up stage, speakers for both today and tomorrow. Please come up stage. Our deans, our directors, our provost, senior management, finance, our registrars, please come up and let's take a group picture. We are coming up stage. Speakers and our dignitaries, please come up stage.